Good morning, everyone. Thank you so much for the invitation, and I'd like to start first and foremost by thanking and acknowledging my hosts, all of you here at the university, and certainly Dr. Finnegan and Dr. Rhonda Jones-Webb. She's just been so gracious, as her staff and colleagues have been, in facilitating my joining you this morning. I am going to try to be very mindful of time because I'm talking to you this morning about a subject that is so integral to my own personal beliefs and the work that I've done throughout my career. And having said that, you might appreciate the fact that I could probably talk much longer than my allotted portion of the agenda. So I'm going to try to keep my eye on my watch in order to keep within the time and hear my co-presenters and the wonderful words that they want to share with you this morning. But I'm going to start by reflecting on something that inspires me a lot in my work, and it's a quote from Pope Paul VI, of all people, and it's on the wall in my office. It's something I see and think about every day. If you want peace, work for justice. And I offer a variation on that remark, that quote this morning, because it often occurs to me that if you want health, we must work for equity. We won't have a healthy community, you won't have a healthy society unless we can achieve a state of equity. So I'm going to talk about that within the context of the theme for our event this morning, building safe and healthy communities. That sounds so rational, so reasonable, and yet is such a complex and frankly a very elusive goal. A growing segment of our population here in the Twin Cities, in your state, in the region, frankly nationally, struggles consistently and constantly with health challenges. And so many of those challenges are both preventable and treatable, and yet we haven't seemed to be able to interdict and to stop those things from occurring. And it's more shocking that the burden of those challenges falls very unfairly, very inequitably on certain segments of the population. So for people of color, they are much more likely to die young, have shorter lives, and the quality of the lives that they do live is compromised throughout them by disease, by illness, by injury. And almost consistently, that circumstance is not due to the biology or the physiology of those people, but it's due, frankly, to where they live. It's their zip code. Their zip code is having a bigger indication on their health outcomes than any other factor. So about 6 years ago, PolicyLink issued, and I co-authored, a report called Why Place and Race Matter. And the genesis of the report focused on two major points. One was this impact of how where you live affects your health, impacts your health. And we talked about the social determinants of health, and it was so gratifying to hear when Dean Finnegan was just talking about the way in which foundations like Robert Wood Johnson or greater definitions of health have broadened beyond health care or your physical health state, but to talk about these social determinants, all the things in your environment that really make up your health and your health outcomes. Lack of healthy food, lack of transportation, parks, recreation, all of those things and the absence of those things is having a tremendous impact on our health. But the second factor that came through in that report and in our research was the obvious conclusion, frankly, that our nation's long history of racist policies and practices, of racially controlling and conceptualizing and then implementing policy making defines where people live because of their race. So it gets to the place where you can tell where someone lives based on their race. You can pretty much tell, if you know what their zip code is, what the racial makeup of that community will be. And we can also tell almost completely that if we know someone's zip code, we can predict how long they'll live and the quality of the life they'll live. That is inherently unfair. That is inherently unjust and inequitable. At PolicyLink, we work really hard to help people understand and appreciate what equity means and distinctions between what equality is and what equity is. And I'm going to talk about that a little bit more in my remarks. And I'm also hoping that when we have the question and answer series, we can delve a little bit more deeply into these notions of equity. But we also try very hard to focus beyond what is has become the common way of determining or common way of examining these issues, and that is to talk about disparities. Disparities really just gets you at the differences. One population, one group within a population having this particular outcome as compared to that one. It doesn't go into the rationale, the reason, the causes of those differences, and it doesn't get us to the place that I think the term equity gets us to, and really being able to understand and push for change. So what our assessments and our evaluations are telling us is that an inequity in health is something that's not just different, but it's unnecessary and it's unjust. We're seeing that people are experiencing life differently because of the color of their skin, because of the places and the communities they live in, and because those communities have been subjected to disadvantage, frankly, because of the color of the skin of the people who live there. We have an extraordinarily stratified society here in this region, but also beyond it in other parts of the country and other communities and states. I've been feeling very hopeful recently that our understanding of these factors, the understanding of what health equity means, the understanding of what it will take to reverse those historic trends, I was feeling very hopeful that we were moving past it, moving beyond it, sharing and broadening and understanding. And yet in the last year or so, I've come to feel worried, concerned. I'm trying to use the most diplomatic terms that I can use. And I see this incredible division. Not that our nation hasn't always had those rifts and those divisions, but they're strengthening again. They're putting us into factions. We're in a place of accusing each other and attacking each other and being attacked by systems, by speakers, by political leadership. Attacked for our beliefs, attacked for the way we dress, attacked for our lifestyle, and then attacked for our nationalities and where we come from, our faith, our race. Those things are moving us away from being able to understand what equity is and ultimately to achieve it. And yet, we have to address these issues now. We cannot continue on the path that we are because it's an unsustainable model. The need to get this right has never been more urgent because despite what people believe, despite the prevailing attitudes of dividing into these factions and everybody being able to attack each other, our nation has been changing over the past 20, 30 years, and that change is inevitable. The demographics of our country are such that within 25 years, the majority of the people in this country will be people of color. In California, where I'm from, that's already happened a long time ago. And we see that children born today in the United States are much more likely to be children of color. So it isn't tenable or sustainable to just look away and say, too bad that people of color are faring worse. It impacts the entirety of the nation if we do not address the needs and the potential of people of color, particularly young people. The country itself can't prosper unless those young people, and frankly, the majority of the people in the country are prospering, the country will not prosper. That is a very, very hard issue for a lot of people. It becomes a question of attacking and perhaps responding to their fears. Fears sometimes, I think, that are heightened by the discourse that's happening in our nation right now. But we need to unpack that and understand that it does not have to be this us against them analysis or paradigm. This is not a zero-sum game, and that is unfortunately the way we tend to look at it, that addressing the needs of one community, addressing the needs of one population means giving up something that I have. It is actually possible for us to all benefit and all prosper by addressing each other's issues, by attending to the needs of all segments of the population. So I would refer you to a document that we've just released at Policy Link. It's authored by our founder and CEO, Angela Glover Blackwell. Some of you may know Angela's work. But she authored a piece that's been in the Stanford Review called The Curb Cut Effect. And in that piece, and you can find it on our website, policylink.org, that you appreciate what equity really means. Equity as opposed to equality. Equality means pretty much giving everybody the same thing. Equity is a standard where you're addressing what people's needs are, and they may not be identical. So in a sort of a superficial way to describe this, and I don't mean to discount the importance, but in an equality analysis, you might be saying, well, let's give everybody a pair of shoes. That seems fair. We all get a pair of shoes. I love shoes. But equity would be giving everybody a pair of shoes that fit. It's not the same thing, and it's not the same thing to give everybody the same input if the outcome isn't going to be identical. So in the curb cut effect, the article talks about the struggle that activists for disability rights made several years ago in the 1970s, I believe, where they were challenging just the ability to get through a city, going down those big bumps on the curb, and it actually was an act of sort of political revolution where folks poured their own concrete to make some ramps so that they could roll down with the wheelchair. And it ultimately led to, in conjunction with the Americans with Disabilities Act, wholesale requirements and obligations placed on both the private and the public sector to think proactively about the needs of people who were in wheelchairs and to be able to accommodate their mobility issues. And it's led to things that I'm sure you've all seen, and some of you are so young you probably take them for granted: grab bars and showers and those curb cuts throughout almost everywhere in our society, and all kinds of other physical changes that have been made to our buildings and our communities. And those curb cuts have made an incredible difference, allowing people to be independent, allowing them to have that mobility. But it isn't just the people that have been confined to a wheelchair who benefit from the curb cuts. Because I just got here with my little rolling suitcase, and I don't know how many curb cuts I had to utilize to get through that. And we see them with people with baby carriages pushing them. And we see trolleys or whatever those little carts are that workers use when they're moving things throughout city streets. And we see people on bicycles and kids on skateboards, and we tell them not to do it, but they go sailing through. Lots of us benefit. And so to make an analogy to the point that equity isn't just about the population that it might have been designed for, it is about being inclusive. It is about making sure that everybody can participate, and we can all benefit if we work together in that manner. So that's a concept of how we can apply equity in very broad terms. Let me bring it down a little bit to the challenges that public health has, and I think that most of you in the audience have a connection to public health in the public health field. You have the obligation, frankly, as practitioners, not just to study these questions, not just to share with each other your views and to do research and to find terms and perhaps to alert our society about the risks and the dangers that are out there. Because I think this urgency is so great, particularly in a time now where folks are dividing into those factions, the public health realm has to be about being a bridge between policymakers, community residents, academic institutions, private industry, to convene, to help and broaden understanding. If all of these other factors are part of health, economic development, job creation, small business ownership, access to all these other elements in food, you have to, in our society, including food, and I'm going to talk about food in a minute, where will this happen if not through a public health dialogue and conversation? And not just convening the conversations, but I'm really challenging you in public health to become actors, to find out how to partner with all of the forces that are working to make our communities better, the people who have been working toward an equity solution, and I'm worried that some of those advances will be rolled back. The public health field has the ability, I think, to make sure that we don't roll back. It shouldn't matter who's in elected office. It shouldn't matter what political party is in charge. What should matter is what are the current and most intelligent and most effective thinking about how we're going to solve these challenges. But I also want to challenge public health to understand that your action has to be done in partnership. A lot of what you're asking us to address here as speakers, what are the definitions of a safe and healthy community, and how do you overcome disparities, and those sorts of questions, these are actually the questions that community residents, those folks who've lived this experience, those folks who are contending with and enduring and overcoming these challenges, they're in the best position to first and foremost define the problem, and secondly, to devise the solution. So it's not actually that part that is necessary for experts to do, but to make sure that that is advanced and that you're collaborating in order to provide a forum for people to have that opportunity to devise solutions and then moving forward to implementing those solutions. That is really the key place that activists, advocates, and partnership and collaboration can occur. So the first step to make sure that you're effective as partners and effective as collaboratives is to listen. And I have to tell you how rare that is. I've been working in this field 35 years, frankly, trying not to admit to it. But the reality is that I've never been in a community, and I've worked in public housing projects in South Los Angeles. I've worked with folks in agricultural farm workers in way northern counties, very rural areas, in California and other parts of the country, and in absolute destitute poverty, and I've never, ever, ever come across people who don't have a dream for what they want their community to be like, who don't have a vision of what would make their lives better and the lives of their children better. What they don't have typically are people who listen to them about that and partners that help them make that a reality. So that's what I would encourage you to do. Residents will tell you, community residents will tell you what's safe and what's healthy. They'll absolutely tell you. They may not use the same terms that you use, but they absolutely will tell you what that is for their reality. I'll start with a question of safety. And so when you say safety, most journalists or experts, pundits, that's the word of the day, they'll immediately go to safety from crime. They'll talk about violence, they'll talk about criminality. And so for a response to that sort of risk or threat, their response might be more police, more militarizing of the police that we have. But I will bet that if you ask people who live in the communities that have been so marginalized and so labeled as being unsafe, that neither of those things are what they would like to see to make their communities safe. They're not looking for excessive policing. I come from South Los Angeles, born and raised, and literally we are in the month of April, and it is the 25th anniversary of the 1992 civil unrest that followed the beatings, followed the trial of the officers who beat Rodney King. And our city erupted in 1992 as a result of the release of the verdicts, but the places in which people had been talking, frankly, for years, the places that became the ground zero for violence were places that community residents had been asking policymakers, asking city council representatives and their mayors to address. And they had nothing to do with Rodney King. They were talking about the fact that there were an oversaturation of alcohol outlets in their neighborhoods, and each one of those outlets was a breeding ground for addiction, for criminal activity, prostitution solicitation, gang solicitation. And in fact, one of those liquor stores, residents had been meeting, and I was with them 2 or 3 nights before the civil unrest to ask the city to create a system where liquor stores could be held to a standard of operation which would discourage this sort of nuisance and criminal activity. And the next night, when the verdicts were released, 150 liquor stores burned to the ground. The flashpoint of the civil unrest, which many people know about as truck driver going through an intersection, Reginald Denny was pulled out of his truck and beaten very badly by some guys in the neighborhood who were supposedly frustrated at the verdicts. But they had been sitting all day as they always did, getting high, as they always did, in front of a liquor store that community residents had been trying to close down for years. And that liquor store was at the intersection of Florence and Normandy, which is where that incident occurred. So for people in the community, they'd already felt unsafe and unheard about what was happening in their community. And they were shocked, they were dismayed, they were disappointed at the violence that occurred at that intersection, but they were not surprised. And that store still is open, and that store still does not operate up to a standard that we would expect. There were over 900 liquor stores in South Los Angeles in those days, and that was more than several states in the United States had in the entirety of their state. The oversaturation of those liquor stores was and still is an indication of the value of that community, of what it is entitled to, what it is in need of, and how it functions. And that image is not lost on the people who live there. So if you ask them what they need in their community, if you ask them what would make their community healthy, it may not be what academics would say. You need more healthier walking activities, or you need to have gluten-free food or something else. Sorry. I went to a presentation once and I had to follow a gentleman who said that the answer to everyone's problems was to eat more blueberries. So I always have to remember that that's a belief system as well. In any event, the point that I'm trying to make is that not wanting excessive amounts of policing, not wanting to see a police force militarized, and I'm seeing in my mind's eye the images of Ferguson with the over-militarized police force in that community meeting a reaction of the community to a horrific incident. The fact that folks don't want a lot of police in their environment does not mean that they're willing to tolerate violence or that they don't want a response or reaction to reduce crime, to protect them. But the violence, and they recognize this, the violence is a symptom of a problem, and we go back, if we understand that symptom, to understanding what health is. Safety is the same thing. Safety is being able to have the highest quality of life that you can have, and that requires these absolutely threshold elements in your community of a good wage that supports your family and housing that keeps you safe and that does not have exposure to toxics and making you sick just living there, or a community that's not in the midst of toxic waste disposal or dirty air or dirty water. And when you see all the resources that should be going to those things going to policing, it creates a level of disregard and lack of understanding. It represents that disregard and lack of understanding that, as I said before, is not lost on the residents of these communities. So listen, and people will tell you what their issues are and how they define their problems and what they would seek as their solutions. And if you do that, you'll be able to assist them as they move forward to make those changes in their communities. And I would suggest, too, that you keep some very, very basic elements in whatever strategy you use. In a second, I think I have a few minutes more to talk about a couple of food strategies that might be an example of how you go about doing this. Our view at PolicyLink is that we're trying to accomplish creating an equitable community. And all of the elements that we could talk about, transit, job creation, small business opportunities, food, access to healthy food, access to health care, and any one of them, you can embed in those approaches that will make the system that you're focused on a more equitable system. And the elements are the same regardless of which system you're looking at. First and foremost, this question of power. Who's making the decisions? Who's benefiting from the current structure, and who could be benefited if we were to change it? Who's leading and making the decisions about what's causing or creating the system that I live in? Can we infuse whatever we're working on with some sense of economic justice? Are there jobs created to this or connected to this system? And there always are. Are there small business opportunities, ownership opportunities? And there always are. And so we have to talk about taking those things and shifting them to the communities, to the community residents that are always marginalized, always left out, and make sure that they're the primary participants in a new system that we create, and ultimately the beneficiaries of that. So ownership, leadership, self-determination, economic justice, political power, whatever system you're working on, transportation, food, policing, in every single one of those, there are questions about how we can do that in an equitable way. So I don't know if I have any more time. Do I have time? So I'm going to go real quickly through some slides that apply this strategy in looking at our food system. We have an inherently inequitable food system. I would need a little bit more time to talk about exactly how that has happened over the genesis of our nation, but suffice it to say, at the founding of our country, we've been disconnecting people from food systems that would be healthy and supportive of their culture, supportive of their longevity, supportive of a good quality of life for them. And it may have been pushing native peoples off their land or slaughtering buffalo hundreds of years ago. Today it may be fast food outlets and shifting the way we create policies so that you can use your EBT at Burger King, but you can't use it at a farmer's market. So those kinds of policy decisions and the way in which fast food outlets, for example, aren't only feeding us food that might not be very good for us, but the workforce in the fast food industry is predominantly people of color, very often women, much more frequently adults trying to support families rather than young people who are getting a summer job or a weekend job. And so we have some fundamental ways in which our food system is impacting us. 1 in 7 jobs in this country is in the food system. And so we have an opportunity to take that system and make it an equitable one, and it would have multiplier benefits. And that's the thing we love to do, is to have multiplier benefits. So I'm going to go really fast through some of these things and just give you some quick examples throughout the country of places where people have adopted strategies that focus on an aspect of our food system in an effort to make it more equitable. And the first is from Los Angeles, but it's not limited to Los Angeles. I'm using these cities as examples. There are sometimes multiple places that are utilizing the same approach. But in Los Angeles, just as I talked about the saturation of liquor stores, we have a tremendous saturation of fast food outlets. This is one block with all these fast food outlets in one block. And after decades of challenging that there was no development in big swaths of South LA and East LA, where Latinos and African Americans tended to live, we found out that when development came in, it came in with lots of fast food. With lots of fast food. So several years back, community residents, after a brutal series of local advocacy efforts, were able to first pass a moratorium on the development of any new fast food outlets, and ultimately a shift in our general plan, which is sort of the blueprint of development and land use in the city, that requires lots of restrictions on new fast food outlets coming in. So I won't go into all the details, but it just showed that this issue came bubbling up from community residents, and the strategy that they wanted to see was something that they researched, and that attorneys, public health experts, and others partnered with them in order to get passage of this change that limits new fast food outlets in underserved and, in this case, oversaturated communities. So these are 2 examples that emerged out of other big cities. New York City, using its food cart strategy. Food carts are very common in New York City, and yet there were way too many of them in some folks' belief, and so the city wanted to limit them, and so they stopped giving out new permits for food trucks. But public health, food advocates, food justice advocates said, wait a minute, we want you to permit some of them, but we want them to be food carts that sell healthy food. So those were the only carts that were getting permitted. They have to meet a set of standards for what constitutes healthy food, and in some instances the carts themselves are being operated by non-traditional cart operators, let's put it that way. And so it's created a business opportunity, some food hub strategies in terms of bringing in food from local farmers. So it's got, again, a multiplier effect. It's not just addressing the issue of bringing food into neighborhoods that perhaps didn't have it, but doing it in a way that puts economic power and some voice within the community. And the other is a little insignia from Baltimore, where they developed a healthy carry-out program. It's very common, I think, in Baltimore for people to go get food, not at fast food necessarily, but at small restaurants. And again, there were some incentives and some additional support provided for carry-out food that was healthy. I'm going really fast because I don't have a lot of time. This is a strategy that is almost too simple that every city or county government can do, and that's just to tell people where the land is and who owns it. Communities always have ideas for what they want to see in their neighborhoods. Low-income communities particularly, they're short on parks, they're short on places for farmers markets, they're short on places to do pretty much anything, cultural activity, small business development. And so this is just a question of doing an inventory, mapping vacant parcels, designating the ones that are owned by local government, for example, figuring out how people can have a say-so in what's happening in those vacant lots in their communities. And Oakland, California is one of many places in the nation that has done this. Revitalizing the abandoned lots that do exist. And this is an effort to really put, in this case, urban agriculture, but in Cleveland, I think I spelled Cleveland wrong, the notion of being able to see people be participating in and having a say-so in their food and the kind of food that's grown, and being able to do it locally, and to take down some of the abandoned lots that create a negative, sort of a decaying environment in so many communities. These are two programs, workforce development, Growing Home in Chicago, and then this other one is in Massachusetts. And both of them use non-traditional, quote-unquote, applicants to do urban agriculture and food-related small businesses, often young men in reentry, who are not what usually becomes the poster child for urban ag. And yet, there's a tremendous interest in young people and people of color and people from other parts of the world. We have immigrants from all over the world, many of whom come from a farming tradition and don't have enough space to do growing in their communities. And so these are two examples of that. Both programs have a very vibrant youth component, and they also do a lot of community awareness and education on issues of food and both the health risks and the economic vitality opportunities. Eastern Market in Detroit, which is one of the oldest of these sorts of common markets, and it really has become a hub of small business development, food hub, agriculture, working with local farmers and other vendors to sell at a very vibrant space, revitalizing the community, and also having an external process where they take food out into the community in mobile markets, again, reaching underserved communities where you can't always bring in a large grocery store, and extending to low-income communities and communities of color the same thing that others are experiencing with our sort of hot food interest. We have so much interest in food now. There are cooking shows. The food experience has become part of our entertainment, frankly, and yet low-income people and people of color have often been left out of that, and they've been left out of being able to be part of the job and small business opportunities inherent in a food economy, even though there's such tremendous creativity and skill, and yet permitting, vendor space, initial capital investment, all of these sorts of things have become barriers for people to have those sorts of startup businesses. So Eastern Market is one way to try and resolve a lot of those attendant issues. This one is one of so many examples of placing food where people are. And so we have this issue for low-income people particularly of getting to a place where food is. We talk about the fact that many of us live in food deserts. It's really a long way away from where there's healthy, affordable food. And then I live in a place that's actually a food swamp. Those pictures with all the fast food outlets, well, there's lots of food in the neighborhood, but it's all pretty bad. So the question is, how do you get to the food that you'd like to be able to have? This solution is to put the food at the transit stop where people are already changing the line for a bus or getting on a subway. And this particular one in Dayton has a farmer's market feel, a couple of other little stores or vendors out there that are selling non-food items, and homeless individuals run the market. And so again, there's a multiplier effect there. It isn't just addressing one problem, it's addressing multiple problems. And the homeless staff are also able to get some food while they're there in the market. And there, as I said, there are several places in the country that are connecting transit with stores and food shopping. Boy, I'm really taking too long. So these are just the question of improving small corner stores or even liquor stores or convenience stores, modifying them in order to make sure that they are an opportunity to provide healthy food. And what we found in most places, corner stores are so prevalent in low-income neighborhoods, often because building a big grocery store is difficult, and also because so many of them have been there for so long, and yet they sell all the foods that'll kill you, the sugary, salty foods, the hot Cheetos, the chicharrones, the alcohol, tobacco. So this is an effort to encourage and support some of these small stores to convert over to small grocers. And again, we're finding that many of the stores themselves are owned by low-income folks, by immigrants, by people of color, and many of them are very concerned about their neighbors. Not all of them, but many of them are. And so when you can work with that and support that, again, you have a win-win. And because of their scale, there are so many of them in so many places that are poor. This is true in rural communities too. Sometimes the places where the food is grown, there's no place to buy food. That's certainly true in Fresno. We consider it to be the salad bowl of the nation, Fresno, California, and yet it's very hard for the folks that work in agriculture to find a store to go to, and many of them are served by small stores like this. So we consider this to be a really effective strategy. This is an example from Cleveland Cooperative. The Evergreen Cooperative in Cleveland was a response to job creation where there's a bunch of the whole hospital circuit in Cleveland is a tremendous demand for both food and other small business vendor needs. And so the co-op was created to provide jobs and business ownership for population that had been excluded for a very long time, marginalized, not able to find sustaining jobs. The co-op provided them with that. Their first business was actually a laundry where they do the laundry for all the hospital services. And their second business has been a hydroponic growing venture where co-op owners who are community residents grow lettuce and other kinds of herbs and provide salads and the salad fixings to the hospitals in the region. I think this is my last one. This is Market Creek Plaza, which is in San Diego, California. This market itself was the response to a community insistence that resources, retail, and particularly grocery venues come into a community that had been underserved for decades. It was on an enormous parcel in the middle of 5 distinct neighborhoods of color. We actually called that the 5 Diamonds neighborhoods because there was a Cambodian community here and an African American community here and a Latino community here. And anyway, the 5 communities all converged, but in the middle of them all was this vacant sort of marshy swampland. And it's a long story, but a very, very interesting one. With assistance from a family foundation, they were able to do a community-wide needs assessment, a community-wide focus group, figured out what they would like, and what they would like was, in this instance, a grocery store, retail mall, which was literally designed by community residents and input. It's got art, it's got a cultural meeting space and an outdoor amphitheater. It's got a store that sells crafts and jewelry and things that are made by local artisans and artists that's called Where the World Meets. It's each community is represented in mosaic tiles around and walkways that community residents help design. And these photos that you see are life-size portraits of community heroes, and you can actually see that from the freeway. And then on top of all of that, a supermarket moved into the neighborhood. The community had a chance to discuss the layout of the store. Worked really hard to find a chain that would go in. This is not the chain that they wanted, but it was the only chain that was willing to come into this neighborhood. And ultimately, shares in the property have now been sold to community residents. So there literally is an ownership stake on this property from people that live in the neighborhood. So I'm going to stop, say just quickly that there are many, many resources about these sorts of examples. PolicyLink co-hosts with the Reinvestment Fund and the Food Trust, two other organizations, our Healthy Food Access Portal, which really has an array of issues and stories and illustrations of these kinds of strategies, lots of information on many of the strategies that I didn't even get a chance to talk about. And then we also have our National Equity Atlas, which is a tool that can show you how, if we were able to eliminate the inequities and the barriers, particularly in our economic circumstances, the value, the increase in our domestic product that would result. And you can do this on a census tract and city and regional level. So if you were to take Minneapolis, for example, and say, if we were to remove the inequities in education and employment, wages, and things like that, we'd see the domestic product of Minneapolis increase exponentially. And you can draw these maps and make the case for equity, not just the moral imperative, which is strong and urgent, but the economic imperative, which is what we will all need if we're to survive and ultimately to prosper as a nation. I appreciate your time so much. I've been told I need to advance these slides to the very end, and I've done that. And I look forward to the question and answer period in a few minutes. Thank you.